I'm Roslyn Mannon. I'm originally from New York City. I grew up in Lower Midtown. I went to Johns Hopkins undergrad, Duke Medical School. I then was a resident at Duke in internal medicine. I did my nephrology fellowship at Duke, and then I was a chief resident at Duke. I was on the faculty for a while at Duke, and I had a basic science grant, and then had an opportunity to go to the National Institutes of Health. And so I did translational research there, meaning research in both humans and in the lab, in transplantation, in transplant immune injury. And then I was just recently at the University of Alabama at Birmingham. In transplantation, I'm mostly focused on the recipient and recipient outcomes, meaning their kidney function and their long-term health. So my whole career has really been focused both on the immunologic causes of graft failure, because kidney grafts don't last forever, and I'm also interested in the comorbidities, the diseases that often go hand in hand with having kidney failure, and looking at new strategies, and whether it's a new monitoring test or a new technique that we can use, or provide a new therapy, but always trying to think of more of it as a preventive, prophylactic, not waiting for the heart attack, but treating before the heart attack. And so transplant nephrologists tend to be good internists. We have to know everything, infectious disease and cardiology. We have to sort of stay abreast of all internal medicine. So it can be a bit of a challenge, but really the late graft failure is the area that I'm most focused in. That's most of my research is in that area. I really enjoy clinical medicine, I always have, and I also enjoy research. So an academic center really facilitates my ability to reach out to patients to say, I'm doing this in the lab, but this is what we're doing in people, looking at new therapies, looking at new ways of diagnosing diseases within kidney transplantation. That's my ultimate passion as well. And so doing that is really facilitated by being an academic center. We have a great transplant program here, and we have opportunities to really test new therapies and provide new therapies for our patients. What is it like when I first meet a patient? So obviously I'll introduce myself. I'll ask them why they're there, what made them come to the Nebraska Medical Center, what they're interested in accomplishing that day. Oftentimes I'll always review the notes before I go in. I'll review the most recent labs. I'll review the prior course, any of the issues they may have had. And I'll have some sort of sense of my idea of what I want to talk about, but I always leave it open to them. I'll do a physical exam. I'll then sit down with them and kind of gather my thoughts with them in the room, and we'll talk about, why are they having these issues? Is there a way to fix them? What are the options for their treatment? Try to allay their fears that it's the worst. A lot of times when people are referred to us, they think it's probably the end of their transplant, or they may go back on dialysis, and I know that that's their biggest fear. And so I'll kind of go over their care and their plan. I'll ask them to sort of repeat it back. If they have trouble or don't understand something, we'll go over it. And then I kind of wrap up and say, okay, well, these are the things we talked about today. 1, 2, 3. And do you have any other questions? Is there anything else I can help you with?